Good afternoon, everyone, and welcome to the CJCA Positive Youth Outcomes Committee webinar series. I am Wendy Faulkner, Assistant Executive Director of CJCA. This is our final webinar in a two-part series focused on how to improve services for LGBTQI youth in the juvenile justice system. Today's webinar will discuss improving practice and outcomes for LGBTQI youth. I would like to thank all of you for taking time to participate in today's webinar. And special thanks to Peter Forbes, Commissioner, and Michelle Phillips, both from Massachusetts Department of Youth Services, who have all put a great deal of work into the preparation of this webinar, as well as our presenters for today, who Peter will introduce shortly. For those of you who might be new to CJCA, we are a national nonprofit organization formed in 1994 to improve juvenile justice systems, local secure correctional and residential facilities, services, programs, and most importantly, long-term outcomes for youth and their families. CJCA represents the juvenile justice system CEOs in all 50 states, Puerto Rico, and various major metropolitan counties across the country. At this point, I'm going to ask Darlene Conroy to provide us with a few technical instructions before we start. Darlene?
Thank you, Wendy. We'd like to just review a couple of general items with you for the webinar. At the end of the presentation, there will be a Q&A session. Please type in your questions at any time during the webinar. These will be answered during the 10 to 15 minutes of the webinar at the end. Today's webinar is being recorded. A copy of the PowerPoint and link to the recording will be sent to the attendees following the webinar. Peter?
Hi, this is Peter Forbes. I'm the chair of the Positive Youth Outcome Committee for CJCA. I just want to thank Darlene, Wendy, Charity, and the team at CJCA for their work on this. This webinar builds off a webinar that we did on June 3rd that highlighted Shannon Wilbur from the National Center for Lesbian Rights and Curry Cook from Lambda Legal. They really helped us set the baseline. Today, we're going to get a little closer to the work, and we've got Anders Jacobson, Director of the Colorado Division of Youth Services, and his teammate Samantha Wilson, who works as a Youth and Staff Safety and PREA Coordinator for the Colorado Division of Youth Services. And we're also joined by Avery Niles, Commissioner of the Georgia Department of Juvenile Justice. Anders, Samantha, and Avery are all going to share their experience in this space with us. We're also very happy to have Simone Gonsolin of AIR on to do the Q&A. He's done a really wonderful job for us. I appreciate him taking the time for this. I'm not going to read bios because the bios are posted, so you should be able to pick the bios up of the presenters. So in an effort to save time, I'm going to go right to, Samantha is going to take the lead? Samantha Wilson from Colorado.
Hi, Commissioner Forbes, yeah, this is Anders Jacobson. I'm going to just do a quick introduction and then turn it over to Samantha here shortly. So thank you, and thank you for inviting us. We are happy to participate and present today, but equally anxious to hear the other presentations so we can continue to learn in this area and to hear the questions that may be out there from the participants. If we go to the next slide, please, just going to do a quick overview here. Division of Youth Services here in Colorado, we moved forward with our policy and procedure, training and awareness, if you will, in 2014. And I would say that's really when we started to move forward around having good, clear awareness in treating LGBTQI youth, ensuring that their individual needs were met. As it says here on the slide, it is about ensuring that there's respect and voice and dignity, and ensuring that we were creating a safe environment. The next bullet that we go to here is talking about how we defined LGBTQI, gender dysphoria, gender expression, gender identity, gender nonconforming, and sexual orientation. But equally as important, training all of our staff, bringing continued training to our staff, and continued awareness, so again that we could be providing the best individualized services to all youth in our care. The next slide we put in here, our effort, as I indicated, started back in 2014 in partnership with the ACLU of Colorado, and working with the ACLU of Colorado as well as some other local law enforcement agencies, collaborating on trying to bring together what we believe to be best practice in addressing LGBTQI policy and procedures. So again, happy to be able to present. I'm going to turn it over to Samantha Wilson, who has been a longtime trainer here for us in the Colorado Division of Youth Services, and we'll take you through some of our high-level areas specific to intake and assessment, searching, housing, medical, bathrooms, clothing, and care and treatment. And we look forward to participating, listening, and answering questions. Samantha?
Thanks, Anders. I'm going to go ahead and go through the policy. I'll take the next slide, please. The first portion of our procedures, we focused on the general operations of our youth centers. First and foremost, modeling positive behavior when interacting with all youth is a requirement of our policy. And this part of the policy points out that any anti-LGBTQI threats, any kind of disrespect, suggestive comments aren't tolerated. And we feel that the modeling of staff of this behavior is going to trickle on down to the youth in these areas. Also, not discouraging or prohibiting any communication with the youth based on their LGBTQI status. That's also prohibitive in our policy. Next slide, please. Thank you. The next section of the procedures is pointing out that there is no toleration of discrimination or harassment in any kind, but it also puts some responsibility on our providers and our staff that if they're aware of this type of behavior, they're required to step in. There's also a section that specifies language that cannot be used, nothing that conveys any kind of bias or hatred toward folks that identify as LGBTQI. But this also transfers to folks' facial expressions and the tone of their voice. And we do a lot of work in training with motivational interviewing about how folks can remain professional while talking with youth if any of their personal biases, if they start to feel like that kind of stuff is going to creep in. Next slide. The policy is also specific to our intake procedure. So all of the youth in all of our 10 facilities are going to have at least one, possibly more, admission process. And there's specific instructions that we give to our staff that are involved in that process about how to communicate with LGBTQI youth. And a part of that is gathering information about any non-conforming appearance as it relates to our room assessment, which we'll go into a little bit later. We have a statement of preference form that we would want the youth to fill out if they're identifying as transgender or intersex. And they also are required to not discipline a youth for sharing or changing any information. A part of the youth's right is that if they are questioning and they start to want to approach staff about a transgender transition, that there's not any punishment or discipline for that. Youth can change their statement of preference form at any time. There's a process, but they can change it. This part of the policy also highlights search instructions, and that is for the personal search of a youth's body. There's different types of searches, and the statement of preference form also will speak to the youth's gender identity. Next slide. We respect all youth confidentiality when it comes to things like HIPAA, personal information, giving knowledge on a need-to-know basis, but a youth identifying as part of the LGBTQI community is a little bit different. And what I mean by that is that it's information that we're still sharing on a need-to-know basis, but there is guidance around involving families in this process. And so if we have a youth that is coming out while they're in our facility, the therapy team will talk about our collaborative review team in a second. They're going to be involved in that process of actually determining whether or not it is safe, appropriate, useful for treatment to involve the family in that process, or even inform them that a youth is coming out. Next slide, please. Part of a team that all youth have access to is called a collaborative review team. And what that is a multidisciplinary team that, for the purpose of determining the need and support of youth who identify as LGBTQI, this group is going to come together with the youth and talk about placement decisions, uniform decisions, if that applies, the preferred name and pronoun of the youth. They'll also talk about the gender of the staff that search the youth, any kind of housing decisions. And so our policy requires that that meeting take place within 24 hours of admission. A youth would also be referred to that team if they self-report as transgender or intersex. If there are concerns about the safety of a transgender or intersex youth, then we would refer back to that team to consult with to make those decisions with the youth. And we do require that that statement of preference is reviewed twice per year. We have both detained and committed youth, so it is possible that we would have a youth that was with us for a longer period of time, 2, 3, 4, maybe even 5 years on the long end. Next slide, please. This policy also speaks specifically to youth placement. Once a youth is physically admitted into one of our facilities, that actual placement is going to occur as soon as possible after intake, not to exceed 4 hours. And so that is going to be up to the intake team doing the assessment, which is called an SABVV, and that alphabet soup stands for sexually abusive behavior and vulnerable to victimization. We're also going to look at a youth's risk to be violent. That's in that assessment as well. But for the purposes of our LGBTQI youth, we are going to ask them some questions about their gender identity and their sexual orientation in order to help us find the safest room available for them. This policy specifies that if a single room is available, all youth are required to be in a single room. It also speaks to not treating youth who identify as LGBTQI as sex offenders. And that's an old term that we're not using anymore, and we'll update that, but we now use the term youth that have committed a sexually based offense, which one has nothing to do with the other, but it is specified in policy that that's not a part of a youth identifying as LGBTQI. Another piece that's important with their placement is that the housing is based on the youth perception of their safest place to be. So unless they're creating a security issue that would not allow us to go with their preference, then they're going to be housed where they're the most safe and the most comfortable. Next slide, please. We have some policy statements when it comes to things like name and language. So this really gets more specific into that a youth's name and pronoun will reflect their preference. Once that is done, then they have a right to be called by that name and by that pronoun by anybody that's interacting with them. They also have a right to follow hygiene and grooming practices that match their gender identity that they have put into their statement of preference. They're permitted to use bathrooms, showers that are consistent with their gender identity. They are required to shower separately, but so are all youth. So there's no communal showers or bathrooms in any of our youth centers. Next slide, please. We have a section in here on medical and behavioral health care. So our youth have a right for us to offer access to knowledgeable providers. And so we will try to, if it's appropriate, we'll try to match up youth with therapists or behavioral health specialists that are most appropriate to work with them based on their background and history and expertise. We're also going to collaborate with external providers to continue any current treatment plan. And for the purposes of this policy, that includes a youth being in any sort of transitional program, any kind of hormone therapy. And we do follow the World Professional Association for Transgender Health standards. So if gender dysphoria exists or there's any concerns with gender identity, that will be assessed and evaluated just like we would any other medical condition or diagnosis, and we'll follow those treatment recommendations. We have had some youth that have become or that have begun hormone therapy in our care. Next slide, please. This section discusses any issues as far as searching a youth. We're very specific to prohibit searching a youth to determine their gender. That is not allowed. Any type of search has to be done by a staff member that shares the gender identity of the youth, if that is on the statement of preference form. It also has to be documented specific to the type of search that it is. So we have a little bit of a different documentation process if a youth who identifies as transgender or intersex is engaged in a full search. And we use the term full search. We've updated the policy. We used to call that a strip search. And we have a new procedure in place that really looks at the possibility of a strip search or a full search or any type of bodily search like that causing trauma in the youth. So we really re-looked at our search procedure, which is really helpful in this case too with youth that identify as transgender or intersex. Next slide, please. The final procedures in the policy talk about notification and transportation issues. So with as many youth as we have, some being committed, some being detained, they have lots of reasons to be transported out of our facility, whether it's in between facilities or they're being passed off to another agency. But our policy states that in any transportation situation, whenever possible, and it's possible, I would say 99% of the time, employees of the same sex as the transgendered youth's gender identity have to be present during transportation. We also will provide a critical advisement or information form to the agency that we're passing the youth off to so that they have the same information that we do as far as the youth statement of preference. And the training piece, go on to the next slide, please. The training piece, what you're seeing here on your slide is just a snip out of our online onboarding program. It's the menu that is highlighting the different sections of the training. So within the first 6 months of their employment as a Division of Youth Services employee, they need to go in as part of their onboarding program, and they need to take the online, the web-based training, and then pass a quiz at the end. So they've got some onboarding training. The communication piece is in there as well. And I mentioned motivational interviewing before, but that's a big part of how we effectively communicate with any youth. And they also are required to do annual training. So not only the onboarding, but they have to keep that up at face-to-face in-service trainings once a year. And that is the overview of our LGBTQI policy. I'm going to pass it off to Anders to talk about this last slide and close us out.
So the last slide that you're looking at here is the statement of preference form that Samantha was talking about, that is provided to the youth at admission and throughout their stay with us, that is utilized to address LGBTQI youth. I think our next slide actually moves us to a question slide, and we're going to hand this off to Avery Niles in Georgia.
All right, good afternoon. I hope everybody is doing well, but just like our friends in Colorado, the Georgia Department of Juvenile Justice, we have established operational policies and practices that reinforce the commitment to respect the dignity of our youth, to include in transgender and gender non-conforming youth. We do that by creating a safe environment for all youth to ensure that all youth have equal access, which is very critical, equal access to all available services, care, and treatment. We also, when it comes to LGBTQI youth, we create that respectful culture in an environment that does not further traumatize the youth. And some may ask, how do we do that? We enhance our policies, we establish operational practices, procedure policies, and make certain that all of our staff members understand the totality of the policies. We enhance our screening tools at our intake. Our intake is most critical part of the starting the process to make sure that we do not further victimize the youth. Some of the areas, not only do we use the screening tools, but some of the areas, whenever there's a checkbox that the facility leadership determines that a kid coming in that experienced these types of trauma, they not only do that, but we involve our victim services right off the bat to make sure that our victim services are part of the process. And that process starts at our intake, then go all the way through our handoff in our communities. We develop specific staff training at making sure that all of our staff members have the appropriate technology, or not only the technology, but how do we communicate? What language do we use? How do we identify the youth? How does the youth identify themselves? What do we do as it relates to communication? It's got to be a respectful communication. It's got to be confidential. We can't have staff members that talking about our youth in an open environment. It's got to be very, very confidential. We prohibit discrimination. This is not a workplace where folks are discriminating against each other, regardless of what they come in our facilities and identify at. We provide our support, and here's a unique opportunity. Our mental health staff members here in Georgia work so diligently with our vulnerable population as it relates to those kids that come in our system, and our mental health services provide that care and custody treatment, making sure that the case management services, our handbook for our youth, as well as the handbooks that we provide to our staff members, are updated with all of the relevant policies and procedure. We have 26 facilities in Georgia, and we make certain that all of our staff are trained on a regular basis, especially those that provide that direct support, provide that support on an ongoing day in and day out basis. When we look at our policy, we make certain that those policies meet all PREA standards. And of course, that starts with our intake. We do an onset to where our administrative area of our facilities are aware of our folks that come in, our young people that come in, that identify to how they prefer to be treated, how they prefer to act. We take all that in consideration. And one of the unintended consequences is that when a kid is ready to transition out of our secure campuses, the unintended consequences when they transition out is the family members ready to receive that kid that we have identified or they have identified, and we've provided all the services. For an example of that is when a kid leaves us and return to their respective families, are the families able to continue to provide that emotional and physical support in a safe environment so that that person, that youth can survive? Some of the community-based resources that we utilize, our partners, we have several of them, and I'll just name a couple of them. Our Lost and Find, they provide support all the way from ages 18 to 25 in our community. We have a Covenant House. They care to our homeless population, because all kids, when they start to identify, they may or may not be received as if they were different when they came out. So that those Covenant House handles those kids. Chris Kids is one of the areas to where they really give that support to our kids that identify. And then Devereaux and our local child advocate centers play a major part in the transitioning our kids from our secure campuses back out in our communities, so that these kids that's in our care, regardless of the treatment that happens before they get to us, we have a process that's in place to where our kids that's in our care, regardless of how you identify, you will be treated like you are an individual and you have those individual needs. We make certain that our policies, like I said, is in line with our PREA, to make certain that the kids are receiving the best treatment, the best services that one can provide. Just like our friends in Colorado, we do a decent job, but there's areas that we can improve, and we stay up on current policies, national trends, as well as our providers in our mental health and behavioral health unit working with the kids to make certain that they are receiving all of the services, all of the treatment that we provide, and then we hand it off to our partners in our community so that we can stay informed of the kids' progress. So at this time, that's what we do in Georgia, and I'll turn it over to Simone.
Thank you very much, Avery. I appreciate that. And I want to just take a quick moment to thank our presenters, Anders, Avery, and Samantha, for not only sharing their time, but their experience and obviously their passion around addressing the needs of LGBTQI youth. We also have joined us, as Peter mentioned a little earlier, the presenters from our last webinar, Shannon Wilbur and Corey Cook. So I have several questions that I'll pose to the group. And what I'll do is I will try to tee the question up for one of the speakers, and I'll ask you to respond to the question initially. And then, one or two other speakers, please feel free to jump in there and add to those comments. So one of the first questions we have, what issues have you seen a conflict arise between staff acceptance of policy and procedures, and how did you handle these situations? So I'll toss this out to either Anders or Avery initially, and I'll just repeat the question. I should have given you the name first. What issues have you seen a conflict arise between staff acceptance of policy and procedures, and how did you handle these situations?
This is Anders. I'll go ahead and respond, and then leave it to Avery if he has something to add. So, generally speaking, the rollout of our policy for us surprisingly went fairly smooth. However, to your question, we do come across staff, most notably today in our new hire academy, because they're being the first ones being exposed to this policy. And there are individuals who do not believe, for whether it be religious reasons or they don't want to be put in a place where they have to search somebody that they determine to be of the opposite sex. And so we have to sit down with them and talk to them. This is our policy, our procedures. We believe it's based on best practice. And like other areas of our business, having that candid conversation and hearing that staff member out, but letting them know to really understand if this is the right course of work for them to be in, because it is part of our business in what we do. And so those conversations have happened. I think employees appreciate it, and we've had employees that have predominantly elected to move forward. And, we've had a couple that have not agreed with our policies and do not work for us. The other issue that we have had is that of family members. That for us was a little bit where we didn't have our eye on the ball, I think. We were more concerned about staff and the youth in our care around how they might respond to our policy, but not necessarily with families where the father who has his young girl in our care finds out that a transgender is now being housed in that pod, and that can create other issues outside of staff for people to understand why we do what we do. And that, again, is about having meetings and sit-down meetings and explaining our policy and why we believe it's congruent with best practice.
Wow, and that's from Georgia's perspective. That's a excellent question, and it's one of those type of realization that our female staff members have more issues with the substance of what we're dealing with, and how we deal with that is on an individual basis, because it's an individual that we're talking about, and we do that just like my friends. We reinforce policy, we reinforce our mission, and that's up front to make sure that all of our youth are treated with the utmost respect. And if you're not respecting our youth, we'll attempt to coach you. We have trained you. And if you engage that deviant behavior of not respecting our youth and our care, then let me help you perfect your work record to where we may find you a new address.
Okay. Well, thank you both for that response. Anybody else want to add to those respondents?
If I might, this is Shannon Wilbur from NCLR. First of all, I thought the answers were great answers. And I just wanted to add as to parental objections. Many people raise this issue, and it seems to me that the way to think about it is the same way you would think about parents objecting to any practice in your facility. And in particular, that the parents of one child are not entitled to confidential information about another child in your facility. And even though they might be upset and they've gotten information from their own child, there is a kind of a legal issue there around sharing confidential information about one resident with the parent of another resident. But I totally agree that emphasizing the policy, the reason for the policy, without getting into the specifics about the individual youth, and just leave it at that.
Thanks so much, Jen. Appreciate that. We do have another question. We'll move on. This question comes in asking, well, we all know that in the juvenile justice system, it's not just the juvenile justice agency that's responsible for working with family and children who are in our care, but also other agencies impact the outcomes of youngsters in our facilities. So this question centers around, do other agencies work cooperatively with you in support of your efforts to provide high quality practice standards for youth who identify as LGBTQI? So some of the examples this person has given of other agencies are probation, sheriff's office, law enforcement. So I guess we'll throw this back at Avery and Anders for a response, and then any other panelists may join in as well.
Yeah, and I started in Georgia. It's one of those ongoing communication opportunities that law enforcement, as well as the juvenile justice arena, even the court systems, it's a changing environment. It's one of those type of atmosphere that you just got to be out and call it is what it is. And we have partnered with our sister agencies, and as well as our local police departments, agencies, to where you see where the police agencies are hiring individuals that identify as LGBTQI also. And it's an environment in which it's always changes, and it's an acceptance. And people of have difference of opinions on what should happen or what shouldn't happen, but to push the needle forward, all of us have a dual responsibility, and that's to educate our community, our contract employees, as well as those police departments, to make certain that they are not stereotyping or they're not harassing those youth that come in their care just because they act different, look different, and carry themselves different. Treat them as a human being, and you'll go successful.
This is Anders speaking, and Avery's comments were great. They're spot on, and that's been our experience here in Colorado as well. And it's about sitting down at the table and partnering with the different agencies that we work with. And in a lot of ways, they help us learn. As I opened up our piece here today, one of the external agencies that was ahead of us as Colorado DYS was the Denver Sheriff's Department. They were very progressive in how they wrote their policy in dealing with LGBTQI. So I agree, it's a community education process, and to some degree it's learning from each other and holding each other accountable, and that seemingly has worked well for us here in Colorado.
Excellent. Thank you very much. There are a couple more questions, so we'll move right on to the next one. How can the system provide LGBTQI youth with normalcy? And what examples do you know of opportunities LGBTQI youth have head of your states to engage in developmentally appropriate and normal opportunities in congregate care. It's kind of an involved question there, but I think the focus is more on examples of opportunities for LGBTQI youth in your systems to engage in developmentally appropriate and normalcy sort of activities within the confines of a facility. So maybe if you could just talk to a few examples of this that maybe you've seen, you've witnessed, you've either, or even promoted through an effort to make sure that all individuals who are engaged, both youth and staff, see kids who identify in this way as other youth in the facility, but not labeling them.
Wow, good question. George's approach, of course, it's an ongoing treatment. How do you treat these type individuals that they can have a healthy environment where it's a safe environment? The culture, for Georgia-wise, we would bring in a certain group of people that have this type of lifestyle, and teaching our kids that chooses to live this lifestyle the importance of a healthy relationship going forward, as well as all of the services that we provide geared toward the individual. When the individual seem like they are the ones and they are unconcerned or may have a concern about the level of services, how they maneuver themselves through this maze of uncertainty, because they themselves may have an experience the first time by being in our secure campuses. So it's a level of uncertainty right off the bat in coming in. And then when you have a level of do the staff members condone my outward appearance or my verbalization that I have. So it's a level of continuing education, it's a level of support, it's a level of treatment, and it's a level of just being courtesy about what comes in the door and how you transition and how you create a level of culture that's conducive to that type of individual.
This is Samantha. I would mirror what Avery said. I also want to add that we are really having as a primary focus the individual treatment plan of these youth. And so specifically with our committed kids that have a specific treatment plan that's related to their needs and their risk assessment, that's going to be our primary focus. And if their status or identification as an LGBTQI youth is involved in that treatment plan, well, it's going to be involved in their treatment plan because that's who they are. Whatever kind of external services or wraparound services that we can provide for them so that they're able to successfully complete their treatment program, regardless of their LGBTQI status, then that's what to us, the primary purpose of them being in the Division of Youth Services is. They're here because of behaviors, because of crime that they committed, which is a completely separate issue than their status as a part of the LGBTQI community. So although we honor that status, we want to make sure that staff, that any treatment providers, any contractors understand that one does not have anything to do with the other, because, kind of adding on what Anders was talking about earlier with, how staff respond to this policy. And when we have those outliers that have an issue with it on a moral level, some of those folks do tend to combine that antisocial behavior with status as an LGBTQI person. And so we want to make it really clear that those are separate. And Avery mentioned culture. Well, I would second that. Our culture, treating all youth with respect and dignity, our administrators role modeling interactions with everyone, paying attention to trauma, paying attention to allowing youth to remain with their dignity and not feel ashamed about their behavior or who they are. Those things are really of primary importance to everybody.
Thanks for those responses. Would anybody want to add to that conversation?
Hi, thank you. Yes, this is Shannon Wilbur again. I agree with much of what was just said, and I just wanted to add a little bit more, and to suggest that really all of the policies and procedures that pertain to LGBTQI youth should be based on the idea that variations in sexual orientation and gender identity are normal. They're a normal part of human diversity. And when you come to it with that sort of mindset, there's less of a tendency to pathologize LGBTQI youth and think of them as needing something different from other youth, when in fact they need, as Samantha was just saying, you know, they may have individual needs, but their overall needs are going to be very similar to the needs of other youth, and the unique aspects of their experience are not inherent to their identity. They're external. They're bias that's been directed at them in their families, in their faith communities, in their schools, and so forth, that has caused whatever trauma they've experienced. So that's a long way to say really normalizing different people. People have lots of different characteristics, and creating an environment in which all of that diversity and all those aspects of identity is seen as just part of the human fabric. And as Samantha was saying, creating case plans that are specific to all of that person's identities and experiences.
Excellent. Thanks for giving that information, Shannon. I appreciate it. A couple more. Oh, go ahead.
I'm sorry, Simon. This is Curry Cook from Lambda Legal. Sorry, I wasn't able to join earlier. I was stuck in a meeting, but I also just wanted to add onto what Shannon said about that while the needs of young people are the same, I think what we know is that because of some of the circumstances that Shannon was describing, I mean, we know LGBTQ youth are much more likely to experience homelessness and family rejection and conflict in school settings or in group home settings. And so I think that while the needs are the same and the approach around sexual orientation and gender identity is as a spectrum and a part of identity for everybody is really important, I do think that when we're tailoring juvenile justice system involvement, being able to have these conversations and understand what's going on behind the scenes, and on the flip side, if young people are being released from facilities back into an environment that's not affirming or into homelessness, like all these things are really important to think about, both intervention at the front end, services we can provide during, and tailoring re-entry services that actually get at what was going on behind the scenes that may have contributed to delinquency, and that those things are actually slightly different for LGBTQ young people, for many of them, than non-LGBTQ youth. So it's kind of a combination of all of that.
Great. Thanks a lot, Curry. Appreciate you jumping in there and providing a little more insight. I have another question, and I think probably we need to send this to Shannon and Curry to respond to, but then any others can just jump right in there. The person asked, I'm wondering if there are any examples of ways family courts have gathered SOGIE information, S-O-G-I-E, for youth engaged in delinquency. So maybe what you could do is take a second just to remind folks on the call what SOGIE stands for. Would you mind doing that?
You want to take a Curry, or would you like me to?
Go ahead, and then I could just add a New York specific reference to the court process.
SOGIE stands for sexual orientation, gender identity, and expression. And I think the caller is asking about systems collecting information about individual youth pertaining to their sexual orientation, gender identity, and expression. I'll just say that that is part of PRIA and part of what was talked about, particularly in Colorado, around safety assessment and asking those questions to determine if there are any particular safety concerns for LGBTQI youth. I'm not sure if the caller was asking about courts in particular collecting the information or facilities. So I know more about projects that are working with facilities who are doing safety assessment at the front end to use, and this has been mentioned, motivational interviewing in a private setting to talk to young people, all young people who come into the facility about their SOGI, again, in order to determine whether there are any specific needs related to that that need to be accommodated in the facility. And that's happening in the state of Connecticut, a couple of jurisdictions in Ohio, also in upstate New York, but many, many others as well. Those are the ones I happen to be working closely with. Curry, I think you know about, I think New York might be actually a court system that's collecting data. I'm not sure.
Yeah, so here the New York City's Juvenile Detention Center has been collecting sexual orientation and gender identity information about kids coming in there for I think around 3 years or so now, and are also beginning to do that on the child welfare side at the Children's Center where kids first come into care. And there also there's like a statewide court committee on LGBTQ issues, and there was a family court committee here. So that I think as is true in so many systems, like the court demographic information that they collect and the systems information have not necessarily been welded together, although I know the court system is talking about collecting information themselves. So I think we're not quite there yet, but there are definitely some jurisdictions, including here, that are having conversations with the court and agencies about collecting that information. But I don't think we're quite there yet, as far as I know, in the court place anywhere.
And I would just add one more thing to that, which is, and I'm sorry I forgot to say this, that I know of several facilities that collect, do surveys in their facilities. So it's not information that's placed in any case management system or is part of case planning, but simply to determine the number of LGBT youth or folks who identify as LGBTQI in their facilities, to get a sense of whether there are disproportionate numbers and also any kind of disparities in terms of their treatment or the offenses for which they're charged and so forth. It's a little bit different from a case assessment, but that is also a practice in many facilities.
Great, thanks a lot. I'll throw this out to Avery and Anders. Do you know if you get any information from the courts in reference to SOGI with youngsters that are committed to you, and also Samantha as well?
From Georgia's perspective, we do use the instrument as an attachment to data collection. From the court's perspective, I don't know if we share that with the courts or if the courts have inquired about that. But my vision is that I hope that this will add light, not just here in Georgia, but throughout the United States. Just the type of population that we have, so that we may do it on a national level to where kids are really taken care of based on their needs and not just a status of collecting data. So that's my opinion of I hope that that's what's being done.
Hi, this is Samantha. We aren't aware of any research that that's on LGBTQI youth out of the courts. We collect data ourselves through the risk assessment, whether or not a youth is allowed to have a roommate, the SABVV I mentioned earlier, but we're not contributing data, or we've not been asked to contribute data for any court collection, so to speak.
And are you getting anything from the courts prior to the youngster actually arriving at the facility? I think that was one of the main points.
Not as a rule. It's not a requirement of ours, but we do. It depends on the youth and what county they're out of, what their file has. Some kids we get a lot of information on, depending on how long they've been in the system. Others we have very little, and we just have to go on what the transporting officer or the youth themselves report.
Very good. Okay. Thanks so much. I think we have time for this final question, and it can be for any of our presenters, panelists. Do you know of a proven curriculum, programmatic approach designed for secure care settings that has proven to be effective in working with staff and youth, especially youth who identify themselves as LGBTQI? Is there a canned program? Maybe that's kind of, I'll interpret the question, that could be purchased and somewhat tailored to that particular facility that you've seen success with.
We haven't implemented anything that has been created specific to communicating with LGBTQI youth. The most success that I would say we've had is the motivational interviewing curriculum, which of course is standard in interactions with anyone, lowering their defensiveness and, creating as trauma-free as possible environment as we can. I think that's the closest that we've come to a successful curriculum on that front.
This is Shannon Wilbur. Series Policy Research has developed a training that is designed to help jurisdictions, facilities in particular, to collect SOGI data, meaning to communicate effectively with young people about these issues. I don't know if it's available. It's easy to find them. They're seriespolicyresearch.com, I believe. And that's one, I know that's one curriculum that is specific to that issue.
And is that something you have a link to that you could send us, and maybe we could add to the webinar that's archived? Is that possible?
Sure.
Okay, great.
And this is sorry. I was just going to say that there's also the Equity Project that developed a curriculum that is specific to juvenile justice issues as a whole and LGBTQ youth. And we have done some work with folks at the New Jersey Juvenile Justice Commission who just help develop like some of the things that are out there specific to some of their non-custody staff, and they are working on at some point training a custody staff. So I think there are things out there that people have adapted specifically for custody staff in addition to the what Shannon mentioned. So I think that's kind of what's out there on point at the moment.
Okay, well, we'll include that link as well. Too quick, it's not a question, it's more of a comment. Well, it is a question. Can Colorado share their statement of preference form with CJCA, and it can be added to the website? Is that possible? We have a request for it from a participant.
Absolutely, I can get that to you guys immediately.
Okay, and Peter, before I turn it over to you, I have one more question I think we can get in. How do you manage legal versus preferred name in case notes, court reports, and other documentation?
Question.
This is Samantha. I can answer that for us. We have a database. Once a youth is entered into that database, their name and gender, I believe, cannot be changed ever because they are given a assigned number through that database, and that is for both our Division of Youth Services and our Department of Human Services. However, anytime that an employee has the ability to write narrative about a youth, we require that that statement of preference form be followed. So even though perhaps initially a youth had a male name and pronoun and that's what's officially in our database, if they have completed that statement of preference form, gone through the CRT process, and now their statement of preference is that they have a different name, then all narratives and anything that can be documented as male or female or using the pronoun or the chosen name, we must do it that way. So unfortunately, we haven't yet been able to change the original database, but the staff are required to follow the statement of preference in any kind of narrative or anything they're able to choose after that fact.
And in Georgia, and I'll make it real quick, but for legal purposes, we use the legal name, but however, in our client tracking system, we can utilize that preferred name.
Great. Thanks for that input. Wow, what a wealth of knowledge, both from the research into things all the way to capacity building. Anders, Avery, Samantha, Shannon, Curry, we really do appreciate your time and your expertise today. And without any further delay, I'll turn this over to Peter with a few closing words.
Well, thank you, Simone. That was excellent. I think that the first webinar really fed into the second webinar, and having Shannon and Curry available to work with Samantha, Anders, and Avery was a really, it was advantageous, I think is the word. I also want to give Wendy one more shout out because Wendy was very supportive of us doing this, and we'll be in touch. The other thing is that there is a survey as the participants close out of this. There'll be a survey that pops up, and it'll be very helpful to us if you fill that out and get that to us. This webinar series was prompted through the field, basically asking for more information in this space, and that's basically it. So take care, and thank you to everybody that participated.
Thank you, Peter. Thank you, everyone. Have a good day.